Hi, I'm Dr. Carey Hemmelgarn. I just wanted to introduce you to Module 5. This module, we're going to be talking about rodenticides, the different types, how we're going to treat it, and the overall prognosis. Thank you for joining us. So for Module 5, we're going to talk about rodenticides. We're going to talk about the anticoagulant type, bromethalin, zinc phosphide, and cholecalciferol. There are 4 main categories of rodenticides that they fall into, and that's based on their mechanism of action. In 2008, the US EPA issued a decision to prohibit second-generation anticoagulant rodenticide in residential sites. This causes a change in the rodenticide exposure that we see in our pets. Ideally, we would like to see more anticoagulant rodenticide used, if any were going to be used, but that's not where the EPA trends are falling. So the 4 categories of rodenticide are anticoagulant rodenticide, bromethalin, cholecalciferol, and phosphides. Decontamination is the same for all 4 rodenticides. Emesis should be induced if the ingestion was recent. Usually we say if that's less than 2 hours. If it's been greater than 2 hours since ingestion, emesis may not be useful, but if a large dose was ingested, we may still recommend to hopefully get anything out we can. Activated charcoal is recommended post-emesis to prevent further exposure. If the type of rodenticide is known, then treatment recommendations should be followed for that type of rodenticide and based off of clinical signs and a quantity of that rodenticide that could have potentially been ingested. Unfortunately, we don't always know what type of rodenticide they get into, and all of them look very similar, as in they are small, green, turquoise-colored block. If the type is unknown, then they have to be treated for all 4 types of rodenticide. Anticoagulant rodenticides are divided into group on how long they stay in an animal system. The first generation of anticoagulant rodenticides lasts for 14 days, and that's going to be warfarin, cumaroferol, and pinadione. Bromadiolone lasts for 21 days in their system, and that's a second generation. And other types of second-generation anticoagulants can last up to 4 weeks in their system. The second-generation anticoagulants include brodifacoum, chlorphenencione, diafenicone, diafenilone, diaphenadione, and valone. Anticoagulant rodenticides work to inhibit the production of clotting factors 2, 7, 9, and 10, by inhibiting the vitamin K1 epoxide reductase. The first clotting factor affected is factor 7 because it has the shortest half-life, and if coagulopathy is going to be seen, it would be within 36 to 72 hours of ingestion of the anticoagulant rodenticide. If a patient has recently ingested anticoagulant rodenticide, emesis and activated charcoal should be given, and the patient should be started on vitamin K1 oral therapy for 30 days, usually recommended at 2.5 mg per kg twice a day or 5 mg per kg once a day as a daily dose. Then have clotting factors checked 48 hours after the last dose, so that's 32 days post-ingestion. Coagulation testing should not be done at presentation if a pet has just ingested the rodenticide. If a patient presents with hemorrhage, or concerns for a coagulopathy and rodenticide is a possibility, then clotting time should be checked in these cases. The patient should have clotting times, particularly their prothrombin time, to see if it's prolonged. If it's prolonged, it's potentially consistent with rodenticide toxicity if there's any possible exposure. Pending the patient's cardiovascular stability, packed red blood cell transfusions may be needed if anemic, and if are symptomatic for their anemia. If the patient is not anemic or symptomatic but has prolonged clotting times, we normally consider that greater than 1.5 times the baseline. Then fresh frozen plasma is indicated in these patients. And if they are anemic, they may need fresh frozen plasma and a packed red blood cell transfusion. Coagulopathies should be corrected before doing advanced procedures such as a thoracocentesis for pleural effusion, as you can cause worsening bleeding if we have not corrected their clotting factor deficiency. These patients also need to be started on oral or injectable vitamin K1 therapy for 30 days, and again, they need to have their clotting factors checked 48 hours after the last dose. Bromethalin is a neurotoxic rodenticide. Its mechanism of action is that it affects the mitochondria in the liver and the brain. It causes decreased ATP production, which causes sodium and potassium pumps to fail and lead to intracellular sodium buildup that is responsible for seeing neurologic signs. The intracellular sodium buildup leads to cellular death and associated cellular edema. Unfortunately, unlike the anticoagulant rodenticides, there is no antidote for this toxicity. So early emesis and decontamination with activated charcoal is incredibly important to try to minimize this toxicity. The median lethal dose per pet poison hotline for dogs is 2.38 to 3.65 mg per kg, with a minimum lethal dose has been noted as little as 2.5 mg per kg. Cats, unfortunately, are more susceptible and need a lower dose of this rodenticide to cause clinical signs, and the median lethal dose in cats is 0.45 mg per kg. Clinical signs can occur within 2 hours, but can last up to and potentially not be seen for up to 24 hours after ingestion. And the clinical signs we're expecting to see is ataxia, depression, hyperesthesia, seizures, and in some cases coma. Some dogs that get into sublethal doses can have delayed onset of clinical signs, and it can take days after ingestion for the same clinical signs to appear, or that they can show up weeks after ingestion. Sometimes the clinical signs can appear and then progress for 1 to 2 weeks after ingestion, so there's a few different clinical manifestations. Lastly, some pets can develop delayed paralysis, which is a coma-like state that can take them weeks to recover from when they ingest bromethalin. Treatment involves early emesis and decontamination with multiple doses of activated charcoal. If clinical signs appear, treat supportively with IV fluids, anti-seizure medications, and if there's concern for intracranial edema, then corticosteroid dose would be recommended. If there's concern for intracranial hypertension, a dose of mannitol could be recommended. And unfortunately, the prognosis is very poor once neurologic signs have been present, and unfortunately, if the signs are progressive, then it is most likely going to be fatal. Cholecalciferol, or vitamin D3, is another type of rodenticide, and it's become more popular as anticoagulant rodenticides are slowly being phased out in residential areas. Cholecalciferol is involved in the calcium hemostasis in our body. When this rodenticide is ingested, it causes unregulated calcium absorption from the GI tract and their bones, and this leads to marked hypercalcemia and hyperphosphatemia in our pets. These electrolyte changes, unfortunately, lead to ultimately why we see clinical signs, which is that these electrolyte changes lead to acute kidney failure and soft tissue mineralization within days after ingestion. Clinical signs that we can see with cholecalciferol toxicity include depression, weakness, anorexia, vomiting, increased thirst, increased urination, and pretty severe dehydration. The blood work is going to show what we would expect for it to show, which is elevated calcium, phosphorus, and azotemia, secondary to acute kidney failure. Treatment, if known ingestion has happened recently, then emesis is recommended and activated charcoal administration to try to prevent any further absorption. The toxic dose in our pets can be as little as 50 micrograms per kilogram, so a very small amount. If clinical signs are present, treatment involves IV fluids, antiemetics, sometimes corticosteroids, loop diuretics, and bisphosphonates as clinically indicated. The prognosis is good with early treatment before hypercalcemia and azotemia are noted, but it's guarded to very poor if these are already noted when we diagnose pets with this. The last rodenticide we're going to talk about is phosphide rodenticide, which is a rare rodenticide, thankfully. When zinc phosphide is ingested, it interacts with our gastric acid and creates phosphine gas, which is incredibly toxic. Phosphine gas is absorbed across the gastric mucosa and absorbed throughout the body, but its most concentrated toxic effect that we note is on tissues that have a really high oxygen demand. So the tissues that we're talking about that are most affected by this toxicity is going to be our brain, our lungs, liver, kidneys, and unfortunately the central nervous system. Clinical signs can occur hours after ingestion, which include profuse vomiting, depression, dull, quiet, or abnormal mentation, lethargy, tachypnea, and tachycardia. This is one that we talked about in the second module, in that we have to take extreme care if we think pets have gotten into this when we induce vomiting in a veterinary hospital, because it is something that phosphine gas can be inhaled by our veterinary team and cause clinical signs. So we need to take care that if we are going to induce vomiting in a patient that could have eaten zinc phosphide bait, that the gas is toxic, and therefore we need to do this in an open, well-ventilated area, so potentially outside or in an area that has fans going to increase air circulation. Treatment is supportive for the clinical signs, and the prognosis is good if the pet is asymptomatic 8 to 12 hours after ingestion. The prognosis is variable depending on the severity of clinical signs, but if the severity of clinical signs is very poor, then unfortunately there is possibilities that this can be fatal in pets. So this finishes up our module on rodenticides. Thank you so much for joining us. The next module is going to be on human medications over the counter and prescription that pets potentially could ingest.